Overactive bladder, OAB, is a prevalent and disruptive medical condition affecting millions globally, marked by a frequent, strong, and sudden urge to urinate, often leading to involuntary urinary incontinence. Individuals grappling with OAB face challenges such as constant restroom searches, disturbed sleep due to nighttime urination, and emotional and social hurdles associated with the condition. This video aims to explore 5 effective remedies and interventions for overactive bladder, spanning lifestyle modifications, exercises, medical treatments, and natural remedies. Firstly, the video delves into the 3 main reasons behind OAB. Urinary tract infections, UTIs, can cause bladder irritation and swelling, leading to an increased urge to urinate. Uncontrolled blood sugar, often linked to excessive consumption of refined carbohydrates, can result in heightened blood sugar levels, causing frequent urination due to irritation and inflammation in the bladder. In men, prostate enlargement can press on bladder connecting tubes, creating a false sense of fullness and the need to urinate more frequently. These conditions necessitate immediate medical attention. Moving on to natural remedies, the video introduces pumpkin seeds as a potential solution. Pumpkin seeds contain phytosterols, plant-based compounds with anti-inflammatory properties that aid in reducing bladder inflammation. Additionally, magnesium in pumpkin seeds eases bladder muscles, preventing abnormal contractions that trigger the urge to urinate. Zinc in pumpkin seeds supports immune system function and helps prevent underlying infections contributing to OAB. Verna bark, a traditional remedy with anti-inflammatory and antispasmodic properties, is highlighted next. Used for thousands of years against bladder, kidney, and urinary tract issues, Verna bark helps relax bladder muscles, reducing unnecessary contractions. Available in various forms like capsules, tinctures, and teas, its consumption can be tailored to individual preferences and needs. The importance of vitamin B1 in maintaining nerve health is emphasized as nerves control bladder muscles. Foods rich in vitamin B1, such as nutritional yeast, beef, pork, eggs, wild fish, and sunflower seeds, contribute to better nerve function. Vitamin B1 supplements are suggested if dietary intake is insufficient, with the recommendation to consult a healthcare professional for appropriate dosage. Kegel exercises, targeting pelvic floor muscles that support the bladder, uterus, small intestine, and rectum, are recommended to help regain control over an overactive bladder. Bladder training is introduced as a technique to teach the bladder patients, gradually increasing the time between bathroom visits. This method helps the bladder learn to hold more urine over time, reducing the frequency of the urge to urinate. The video concludes by advising against certain factors that can exacerbate OAB symptoms. Alcohol, being a diuretic, can overburden and irritate the bladder, while sugary foods and drinks may affect blood sugar levels, making the bladder more sensitive. Spicy foods, citrus juices, and highly acidic or processed foods are also discouraged for those with OAB. In summary, the video provides a comprehensive overview of remedies and interventions for overactive bladder, encompassing medical treatments, exercises, and natural remedies, offering a holistic approach to managing this challenging condition. If you found the information shared in this video helpful and informative, we invite you to show your support by hitting the like button and subscribing to our channel. Your engagement is not only a gesture of appreciation but also a way to stay connected with us for more valuable content in the future. Thank you for being part of our community, and we look forward to bringing you more insights and remedies in upcoming videos. Remember to hit that like button and subscribe for regular updates. Until next time, take care and stay well.